Central blood pressure, carotid femoral pulse wave velocity, CFPWV, and brachial ankle pulse wave velocity, BAPWV, provide valuable information about a patient's cardiovascular health and risk of developing cardiovascular disease. CFPWV is considered the gold standard measurement of arterial stiffness, reflecting the time it takes for a pressure wave to travel from the carotid artery to the femoral artery. Arterial stiffness is a common sign of age-related vascular damage and can increase a person's risk of heart disease and stroke. PeriScope is a device that can measure central blood pressure, CFPWV, BAPWV, as well as a patient's current functional vascular age. This information is particularly relevant for diabetic patients, as diabetes is a major risk factor for cardiovascular disease. The ability to measure a patient's functional vascular age with PeriScope is a valuable feature, as it can help diabetologists to identify patients who may be at increased risk of cardiovascular disease despite their chronological age. This information can be used to guide treatment decisions and encourage patients to adopt lifestyle changes that can improve their cardiovascular health and reduce their risk of disease. Additionally, measuring central blood pressure and pulse wave velocity with PeriScope can help to detect early changes in arterial stiffness and endothelial dysfunction, which are common complications of diabetes. By identifying these changes early, diabetologists can intervene with lifestyle changes and medical therapies to slow or prevent the progression of cardiovascular disease in diabetic patients. In summary, the ability to measure central blood pressure, CFPWV, BAPWV, and functional vascular age is important for healthcare providers, particularly for diabetic patients. PeriScope is a device that can provide these measurements and can be a valuable tool for identifying patients at increased risk of cardiovascular disease and monitoring their cardiovascular health over time. By incorporating these measurements into clinical practice, diabetologists can better assess a patient's cardiovascular health and risk of disease, monitor the effectiveness of treatments, and tailor interventions to improve cardiovascular health in diabetic patients. Thanks for watching.